In this video, I'm going to be introducing myself and answering some of your most frequent questions about what I do. So if you're interested in learning more about me or seeing me as a client, then stay tuned. I'm Shaneé Hucks. I use she, her pronouns. I'm a licensed marriage and family therapist associate under the supervision of Dr. Carpenter. I am the owner of and a therapist at Evolve Relational Therapy, PLLC, where we often work with clients regarding relationships. We use evidence-based practices and we measure your progress over time to make sure that treatment is working for you. So what types of clients do I typically work with? Well, I work with a variety of client types, including individuals, couples, partners, and families. However, most of my clients are wanting to work on a relationship or they're being strongly impacted by a relationship. They often are wanting things like a greater sense of emotional safety and security, better intimacy and connection with another person. However, I also see a variety of presenting problems, things like depression, anxiety, life transitions, trauma, problems with sex, intimacy, infidelity, and things of a similar nature. What is your role as a therapist? Well, I have many roles as a therapist, but primarily I'm helping clients map out these negative reciprocal patterns that relationships often get caught by, helping clients to externalize that pattern as the problem rather than seeing a specific person or set of symptoms as a problem, helping clients have conversations in therapy and keeping clients in the moment from getting sucked back into that system. So I take a very active role. I try to create a lot of safety and support. I see clients' strengths. I highlight those. There's just a lot of things that I do as a therapist. Things look a little bit different if you're an individual. We might be working on how you see yourself in relationship to another person and what you can do about your part within a system. Or we might be working more on one of those like presenting problems. So things like how you respond when depression or anxiety shows up and how you get maybe caught in that sort of a pattern of when depression shows up, I don't feel like doing certain things. When I don't do certain things, depression gets larger and it just kind of grows and feeds on itself in that way. So whether it's a person or a specific problem, we do very similar types of work, but it just kind of depends on your needs and who you bring to therapy. What is your model or theory? Well, I think that's a really good question. And the answer is it depends. Depends on if you're showing up as an individual, a couple, or a family, and what you're hoping to gain, what I know about your presenting problem and the research behind what might be effective, and your individual characteristics, what you most need or what would most be helpful for you, and our experience together over time. If there have been things that have been more helpful, of course, we're going to lean towards doing more of those things. So really, it just depends. I do really like the work of emotionally focused therapy. I use that for a majority of my clients because most of my clients want to work on relationships, and the science behind attachment and intimacy is really useful and compelling. However, I want you to know that there really is more in common between models and approaches and theories than there is different. So it's really most important for you to find somebody that you feel like can help you, that you connect with. Also, what's most important about my approach is that I consider myself to be a systemic therapist. So I'm always seeing people in context of relationships and systems and how those systems impact, your relationship. So something like culture, for example. We can't just take a relationship out of the lens of culture because then we miss something very influential that does impact people. And the same is true in the opposite direction. We can't take such a wide lens that we miss these sort of individualized patterns and problems that come up. So I really hold space for a lot of things, and we focus in on where you tell me the biggest issue is or what appears to come up the most. So, what are you like as a therapist? Well, as a client who has been to see a therapist, I know how difficult it can be to sit on that side of the couch, and I try to make therapy as comfortable as possible for my clients. However, I also am so many things that I don't know that I could describe it accurately. It's kind of like my approach to therapy. It's dynamic. I'm active, I'm a good listener, I validate your experiences and concerns. I'm also, more direct, able to be more confrontational in that way, try to keep people from interrupting each other or stepping on somebody else's emotional experience. And so there's really a lot of things that I do and am as a therapist. It just kind of depends on the moment. What are the next steps? So the next steps are for you to reach out to me, give me a call. We can talk more about your specific presenting problem or relationship concerns and how I might be able to help you with those. I offer a free 15-minute consultation to answer all of your questions. And I have some more videos upcoming if you're interested in what to expect for your first sessions, or if you want to learn more about EFT and things like that. Thank you so much for watching. I hope this was helpful for you, and I look forward to hearing from you soon. Bye-bye. In this video, use evidence-based approach. Well, again, it kind of depends, doesn't it? Yourself and a problem maybe creates a system. Yourself and another person is another level of system. There's family, there's society, there's all of these systems that impact us. I'm not passive, kind of sitting back saying, that's interesting. How does that make you feel? That's not what we do. Although we do talk about feelings, sometimes I tell jokes that nobody thinks it's funny.